Minimally invasive total hip replacement under enhanced recovery program is a highly successful procedure allowing the patients to return to good level of activities after the surgery. Preparation is a key component of the enhanced recovery program. Once decision made to go ahead with minimally invasive hip replacement, it is important for the patients to optimize their general health. Conditions such as diabetes mellitus, high blood pressure, or low hemoglobin have to be optimized prior to the surgery. It is important to stop smoking. It is important to restrict the alcohol intake within the recommended limits. These are to reduce the risks of complications such as chest infection, prevent wound infection, etc. Specific to the hip replacement, it is important to do regular hip muscles and core muscle strengthening exercises. This not only helps to control the pain, but also allows better recovery after surgery. The patients might need help from physiotherapists to do the exercises within pain limits. Weight reduction is important if necessary. This again is to reduce the risks such as blood loss, infection, deep vein thrombosis, and general complications. Avoiding infection is very important. Any infection to be treated promptly prior to the surgery, otherwise it increases the risk of infection in the joint and also delays surgery sometimes. Preparing home to return after the hip replacement is very important. Lots of information are given on our website to help you with this. Understanding the procedure and preparation helps the patients to confidently navigate through the journey. Early mobilization is a key component of enhanced recovery program following minimally invasive total hip replacement. As soon as sensation returns in the leg and patients get good control of the leg, they're encouraged to do exercises in the bed. This helps to reduce the swelling and pain around the hip. Also, when they get up the first time with the help of staff and aid, the chance of drop in blood pressure is also minimized. Early mobilization and doing regular exercises helps to achieve the best possible results. Little and often exercises is the key. Prolonged period of rest or exercises might increase the chance of pain around the hip. 2 to 4 weeks, patients can start doing low impact exercises such as swimming or static bike exercises. Gradually they can increase the intensity of these exercises. In my opinion, it is better to wait at least 6 months before returning to high impact exercises such as running. This is to allow better incorporation of the prosthesis within the bone. In my experience, having observed more than 6,000 minimal hip replacement under my care, most patients seem to recover gradually. Some patients make very swift recovery, returning to activities and driving in 2 to 3 weeks. Some patients might be a bit slower to start with, but eventually they make very good progress. At 3 to 6 months, more than 95% of the patients gain good or excellent outcome following minimally invasive hip replacement. Wish you all well.